Master's Shoulder Rehabilitation. The comprehensive shoulder exercise program includes pendulum exercises, stretching, crossover and sleeper stretch, rotation, internal and external, using stick and exercise bands standing and also lying, elbow flexion and extension, abduction in prone position, scapular sitting, protraction and retraction. Trapezius exercises, see the Trapezius Master Plan.
This exercise is the pendulum. The main muscles we're working are the deltoid, infraspinatus, supraspinatus and subscapularis. For this exercise you need a chair or a tabletop. You're going to lean forward onto the chair, supporting your weight with your arm. The other arm is hanging down by your side, just hanging freely. Make sure you want to keep your back nice and straight. You don't want to roll forward. And we're just hanging this arm by our side. What we're going to do here is just move the arm back and forward. So you want to do it about 10 times. You also want to do it side to side. And circular motions as well. So you want to do each about 10 times, and then you'll repeat on the other arm, and you want to do 2 sets of that. So the crossover arm stretch. For this one you should feel it in the posterior deltoid, which is the back of the shoulder. Okay, so you're bringing one arm across as far as you can, holding your other arm on top of your arm, and you've got to hold this for 30 seconds. Okay, you don't want to put pressure on your elbow, so do not pull down on your elbow. You're just supporting it and pulling across as far as you can. This exercise you'll repeat on the other arm, and you'll do 4 times each side. So again on the other arm, and you'll hold this for 30 seconds. This stretch is a sleeper stretch. The main muscles used are the infraspinatus and teres minor. So what we're doing is lying on a flat, hard surface. Your affected shoulder is under your body with your arm bent like this. Okay, so what we're going to do with the unaffected arm, we're going to press our arm down, and we're going to press it until we feel a stretch in the back of the shoulder. Once you feel that stretch, hold it for 30 seconds. After 30 seconds, you'll relax for 30 seconds and then repeat. So we will do 4 reps, and we'll do this 3 times a day. So again, hard flat surface, affected shoulder under your body, and the unaffected arm is applying pressure downwards until you feel a stretch in the back of the shoulders. For this exercise you will need a stick. It can be a broomstick, a yardstick, whatever you need. This is called the passive internal rotation. With this exercise we are working the subscapularis, so you should feel a stretch in the front of the shoulder. First of all, you hold a stick behind your back, as I have here, with one hand, and lightly grasp the other end of the stick with the other hand. What you want to do is pull the stick horizontally across your body until you feel that stretch in the front of the shoulder. You should hold this for 30 seconds. Then after the 30 seconds, you will relax and you'll repeat on the other side. We will do this exercise 4 times each side. Passive external rotation. The main muscles worked are infraspinatus and teres minor. For this stretch, you should feel it in the back of the shoulder. Again, you'll need a stick, broomstick or yardstick. You're going to grab one end of the stick with one hand and cup the end of the other hand. You're going to keep the elbows in against the side, and you're going to move the stick horizontally across with the elbows staying at your side. You should feel a stretch at the back of the shoulder. It should be a pull and not a pain. You're going to hold the stretch for 30 seconds, then you relax and repeat on the other side. So after 30 seconds, relax, change it over, elbows into the side, moving horizontally, keep the elbows in. Again, you should feel the stretch in the back of the shoulders. We're going to complete this 4 times each side.
Internal rotation with band. Stand holding the band with your elbow bent at your side. Keep your elbow close to your side and bring your arm across your body. Slowly return to the start position and repeat. Remember, keep your elbow pressed into your side. External rotation with band. Stand holding the band with your elbow bent at your side. Keep your elbow close to your side. Slowly rotate your arm outwards. Slowly return to start position and repeat. Remember, squeeze your shoulder blades together when you pull your elbow back. External rotation. Lie on your side on a firm flat surface with your unaffected arm under you, cradling your head. Hold your injured arm against your side. Elbow bent at 90 degrees. Keep your elbow against your side and slowly rotate your arm at the shoulder, raising the weight to a vertical position. Internal rotation. Lie on a firm flat surface on the side of your affected arm. Place a pillow under your head to keep your spine straight. Hold your injured arm against your side as shown, with your elbow bent at 90 degrees. Keep your elbow bent and against your body and slowly rotate your arm at the shoulder, raising the weight to a vertical position.
Elbow flexion. For this exercise, we're going to be working the biceps, and we're going to have the weights down by our side. We're going to lift the weight up, nice and slowly to the shoulder, hold for 2 seconds, and drop back down. And up, hold for 2 seconds, down. You should be using a weight that you can do between 3 sets of 8 reps, and you can increase that to 3 sets of 12 reps. Once the weight comes light enough and you find it easier, you can increase the weight. Coming up, 2 seconds, and then dropping it down. Do not swing or go too fast. After you've completed 8 to 10 reps on one side, you can change. Elbow extensions. For this exercise, we're working the triceps, so you should feel that stretch in the back of the arm. Again, we're keeping a nice steady stance, evenly on both feet. We're bringing the arm up above the head, bent behind the head. The other arm is supporting the arm just under the elbow. And we're going to bring the weight up, nice and slowly, hold for 2 seconds, and drop back down. And up, nice and slowly, hold for 2 seconds, and back down. So for this exercise, we'll do it about 8 to 12 reps, whatever you can manage with that weight, and we're going to do it 3 times. So you're going to do it 3 times on each arm.
Prone horizontal abduction. Lie on your stomach on a bench or table with your injured arm hanging over the side. Keep your arm straight and slowly rise it to eye level. Slowly lower it back to the starting position and repeat. Remember, control the movement as you lower the weight. Scapular Sitting. The main muscles are middle trapezius and serratus. Lie on your stomach with your arms by your sides. Place a pillow under your forehead for comfort. Gently draw your shoulder blades together and down your back as far as possible. Ease about halfway off from this position and hold for 10 seconds. Relax and repeat 10 times. Do not tense neck. Scapular retraction protraction. Lie on your stomach on table or bed with injured arm hanging over the side. Keep your elbow straight and lift the weight slowly by squeezing your shoulder blade towards the opposite side as far as possible. Return slowly to starting position and repeat.